breast cancer continues to be a significant health concern for women worldwide. While advancements in detection and treatment have improved survival rates, the best approach to tackling breast cancer lies in early prevention. By implementing proactive strategies, women can reduce their risk and potentially prevent the development of breast cancer altogether. This article explores various early prevention measures that can significantly impact breast cancer outcomes. 1. Know your risk factors. Understanding the risk factors associated with breast cancer is essential for early prevention. These factors include age, family history, genetic mutations, hormonal influences, reproductive history, and lifestyle choices. Being aware of personal risk factors enables women to take appropriate measures and make informed decisions regarding preventive actions. 2. Regular breast self-exams. Performing monthly breast self-examinations is a simple yet effective method for early detection of any changes or abnormalities. Women should familiarize themselves with the normal look and feel of their breasts and report any concerns promptly to their healthcare provider. Although self-exams do not replace mammograms or clinical examinations, they provide an additional layer of vigilance. 3. Clinical breast examinations. In addition to self-exams, women should schedule regular clinical breast examinations with a healthcare professional. These examinations involve a physical examination of the breasts and surrounding areas to detect any signs of breast cancer or other abnormalities. Clinical breast exams should be part of routine healthcare for women, especially as they age. 4. Mammography screening. Mammograms are the gold standard for breast cancer screening and are highly effective in detecting cancer at its early stages when it is most treatable. Women should follow recommended guidelines for mammography screening, which may vary depending on age and individual risk factors. Regular mammograms allow for the detection of tiny tumors that may not be palpable during self-examinations or clinical exams. 5. Lifestyle modifications. Adopting a healthy lifestyle can play a significant role in reducing the risk of breast cancer. Key lifestyle modifications include maintaining a healthy weight, engaging in regular physical activity, limiting alcohol consumption, and avoiding tobacco products. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins is also beneficial. 6. Hormone replacement therapy considerations. If considering hormone replacement therapy to manage menopausal symptoms, women should have a thorough discussion with their healthcare provider about potential risks and benefits. Long-term use of combined estrogen and progesterone (HRT) has been associated with an increased risk of breast cancer. Understanding these risks can help women make informed decisions about HRT. 7. Genetic counseling and testing. Women with a strong family history of breast cancer or known genetic mutations may benefit from genetic counseling and testing. Identifying specific gene mutations, such as BRCA1 and BRCA2, can guide preventive measures and interventions. Genetic counselors can provide personalized risk assessments and help individuals make informed decisions about risk-reducing strategies. Conclusion: preventing breast cancer early requires a comprehensive approach that includes understanding individual risk factors, regular self-exams and clinical exams, appropriate screening with mammography, and adopting a healthy lifestyle. By implementing these strategies, women can take proactive steps towards reducing their risk of breast cancer and promoting overall breast health. Early prevention is key in the fight against breast cancer and can lead to better outcomes and improved quality of life.